So we have to know how to approach elbow radiograph, as the elbow radiograph is a very essential initial investigation to determine the pathology of the elbow. We can start from the peripheral to central. What I mean is from the soft tissue to the bone, or from the bone to the soft tissue region. Okay, if you start from the soft tissue area, make sure you see all the soft tissue area from the subcutaneous, cutaneous to the bone region until to the cornet process, cornet fossa or cornet fossa. If you saw the cortical margin, see from the proximal to distal aspect, medial to lateral, radial to ulnar in terms of cortical margin. And don't forget to inspect the trabecular pattern of this region. I will explain later. Bony alignment of each of the bone should be assessed, and joint congruity should be assessed also. Don't forget to see the review area, I mean hidden area, actually the proximal part of the humerus, the radial head, the cornet process, and also the alignment between the radio ulnar joint. We start with soft tissue. Don't forget to see all the soft tissue muscle shadow surrounding that. Okay, a pattern of soft tissue shadow behind that. And what I mean in the anterior fat and posterior fat here. So, despite of that, we have to see the posterior fat pad or anterior fat pad. The anterior fat pad is able to visualize in normal, but they should not be visualized the posterior fat pad. If the posterior fat pad is visualized, this indicate that is efficient within the joint itself. So cortical margins, as I said to you before initially, we have to see the integrity of a cortical from the proximal to distal, okay, and from medial to lateral region, okay, and also seeing the integrity of the cortex in the radio and also the ulnar region here. Don't forget to see the pattern of this trabeculation of each of these, okay. The circle within the olecranon fossa here, lateral aspect also similar. The figure of 8 appearance should be present here, and the integrity of the anterior and posterior cortical region. Part of that, we have to assess the bony alignment, starting with the anterior humeral line, where it's been line drawn from the shaft, mid shaft of the humerus down to the capitulum and should be intersect the capitulum. If we divide the capitulum into 3 segments, the anterior humeral line should intersect the middle part of the capitulum. The next alignment is the radiocapitular line, the line that made from the mid shaft of the radius down horizontally to the mid part of the radial head, and this line should be intersect into the capitular region. So it means that the radiocapitular line is still in alignment. For the carrying angle, there's 2 lines should be drawn from the humerus down to the mid part of the trochlea, and another line drawn from the ulna, mid shaft of ulna, until the mid part of the olecranon process. This intersection of line known as the carrying angle. For male, it should less than 11 degree, and for female, it should less than 40 degree.